Welcome back to the deep dive. Today we're going deep on dyslipidemia management in India.
Ooh, interesting.
Yeah, we're going to be taking a look at some brand new clinical practice guidelines that were just released by the Cardiological Society of India,
Very cool.
which is perfect timing because you told me you're prepping for a cardiology
Yeah,
conference.
exactly.
So you're going to be well armed with all the latest knowledge.
Awesome, can't wait.
And, these guidelines are particularly relevant because of that 2023 ICMR India-B study that showed just a staggering prevalence of dyslipidemia across various states in India.
It's true. What's fascinating is that India faces such unique challenges when it comes to this. It's really making these guidelines particularly relevant.
So tell me, why are these Indian guidelines such a big deal? Why is this so important?
Well, I think for starters, India leads the world in coronary artery disease cases.
Wow.
And dyslipidemia is a major culprit. It's a huge risk factor.
Right.
And so, these guidelines really highlight the urgency of getting this under control.
Okay, so you're saying these guidelines are kind of a wake-up call, like, hey, we need to pay attention to this.
Exactly.
And I bet those stats from the ICMR NDAB study really drive that point home. What were some of the numbers that jumped out at you?
Well, it was pretty alarming to see the high prevalence of different dyslipidemias across the various states. For instance, in Kerala, over 50% of the population has LDL cholesterol above 130 milli-GDL.
Over 50%? Wow.
Yeah.
That's a huge number.
It is.
Okay, so we know it's a big problem, but what are these guidelines actually recommending? Like, what's the takeaway for someone like you who's going to be at this conference?
Well, they really emphasize a know your numbers approach.
Yeah.
So we're talking total cholesterol, LDL, HDL, non-HDL, triglycerides. It's not just about cholesterol, it's about the whole picture.
Got it.
And they actually break down risk into 5 categories.
5.
Yeah, from low to extremely high.
Wow, very specific.
Each with specific lipid targets.
So it's not just about lowering cholesterol across the board. It's about personalized targets based on individual risk.
Exactly.
That makes a lot of sense, especially when you consider the different patient profiles you'll be seeing at the conference, right?
Precisely. And speaking of personalized approaches, the guidelines have some fascinating insights on how South Asians respond to statins.
Oh, interesting.
You might be surprised to learn that.
Wait, before we get into statins, can you remind me, what's the big picture approach these guidelines are advocating for? I remember reading something about earlier is better or something like that.
Right, they have this catchy phrase, earlier the better, lower the better, longer the better, together the better.
I love that.
It really emphasizes early intervention, aiming for low lipid levels, maintaining those levels over time, and using a combination of strategies.
Okay, so it's not just about medication. It's about lifestyle. It's about early intervention. It's about a holistic approach.
Exactly.
I love it. Okay, now statins. They're the go-to, but as you mentioned, there's this whole South Asian angle. What's going on there?
Well, research suggests that South Asians might be what we call statin hyperresponders.
Statin hyperresponders.
Essentially, they experience the cholesterol-lowering effects at lower doses compared to other populations.
Interesting. So they might need less medication to achieve the same results?
Exactly, but there's a flip side. They could also be more sensitive to side effects.
Oh, I see. So it's kind of a double-edged sword.
In a way, yeah.
Okay, so finding that sweet spot with dosing is crucial.
Absolutely.
It really highlights the need for careful monitoring and personalized care, which, if I remember correctly, is a big theme throughout these guidelines.
You're absolutely right. It's all about tailoring the treatment to the individual.
Make sense?
Now, speaking of tailoring treatment, the guidelines also delve into a whole arsenal of non-statin drugs.
Oh, interesting.
But there's one I think you'll find particularly intriguing, especially given the adherence challenges we talked about earlier.
Okay, I'm all ears.
Have you heard of inclisiran?
Inclisiran. That rings a bell, but refresh my memory.
It's a PCSK9 inhibitor, but here's the kicker. It's a twice-yearly injection.
Wait, twice a year?
That's right.
Wow, that's amazing. If it's as effective as they say, that could be a game changer for patients who struggle with taking daily pills.
Exactly. And it really speaks to the guidelines' emphasis on finding solutions that fit into people's lives, not just throwing medication at the problem.
Right. It's about making it easy for people to stick to their treatment plan.
Exactly.
This is definitely something I'm going to want to mention in my conference presentation.
It's cutting-edge stuff.
Yeah. It's always good to have some of that up your sleeve.
For sure.
Now, we've talked cholesterol and all these fancy medications, but what about triglycerides? They seem to get less attention, But they're a big deal in India, right?
Absolutely. And the guidelines really highlight their role, especially in relation to obesity, metabolic syndrome, and diabetes.
Which are all major issues in India,
Just
right?
huge issues.
Yeah, and that ties back to the lifestyle piece of the puzzle, which I know we'll be digging into more later.
Definitely.
But before we go there, let's talk about HDL, the so-called good cholesterol.
Okay.
I'm guessing it's not as simple as the higher the better.
You guessed it. The guidelines actually kind of debunk that myth.
Oh, really?
Yeah, HDL is more of a risk marker than a modifiable risk factor.
So you're saying I can't just tell my patients to eat their oatmeal and everything will be fine?
Well, a healthy diet is still important, but when it comes to HDL, it's more about looking at the overall lipid profile and addressing any imbalances.
Okay, so if medication and HDL aren't the whole story, what role does lifestyle actually play in managing all these tricky lipids?
Oh, lifestyle is huge E,
Okay, good, because I was getting worried there for a second.
especially for triglycerides and HDL.
Hmm.
And here's where the guidelines get really interesting, particularly for your audience at the conference. They offer dietary recommendations specifically tailored to the Indian context.
Okay, tell me more about that.
So they talk about limiting trans fats and refined carbs and sugar.
Right. Pretty standard advice.
Yeah, but what's fascinating is their take on oils.
Oh, yeah. I remember reading something about that.
You know how certain oils might be better suited for the Indian diet?
Exactly.
Yeah. So the guidelines, they recommend oils high in monounsaturated and polyunsaturated fats,
Okay.
like those found in the Mediterranean diet.
Right.
But they also acknowledge that traditional Indian cooking often involves frying,
Right.
which can be problematic with certain oils.
Because of the smoke points.
You got it. They can break down at those high temperatures.
Yeah, create those harmful compounds.
Exactly. So they suggest considering traditional Indian oils with higher smoke points for frying,
Okay.
like mustard oil or groundnut oil.
Interesting.
Yeah, it's about finding a balance.
Right, a balance between cultural practices and healthy choices.
Precisely.
That's something your attendees will definitely appreciate,
I think so.
especially those working with diverse patient populations.
For sure. Now, speaking of diverse populations, the guidelines also tackle those special cases.
Oh, yeah.
People with other health conditions.
Right.
Dyslipidemia management gets another layer of complexity when you factor in things like diabetes,
Oh, absolutely.
kidney disease.
Yeah, I remember reading that statins, which are generally considered safe and effective, can actually be problematic for people with liver disease.
That's right, because statins are processed by the liver.
Right.
So if someone has liver damage, it can lead to complications.
Makes sense.
The guidelines are very clear about this, and they provide alternative treatment options for these patients.
So again, it's about personalized medicine,
It is.
tailoring the treatment to the individual.
Exactly. Now, speaking of specific groups, let's talk about young people.
Okay.
I know we touched on the importance of early detection, but what are some of the key recommendations for managing dyslipidemia in children and young adults? Well, first and foremost, lifestyle interventions are paramount. So, encouraging healthy eating habits and regular physical activity from a young age.
Right. It's so much easier to build healthy habits early on than to try and break bad ones later.
Oh, absolutely. And it's not just about preventing future problems, it's also about addressing existing issues.
Okay.
The guidelines recommend selective screening for children as young as 2 years old if they have a family history of dyslipidemia or other risk factors.
2 years old. Wow. That seems pretty young to be thinking about cholesterol.
It might, but early detection, even in childhood, can make a huge difference.
Right. It makes sense.
For example, identifying familial hypercholesterolemia early on allows for early intervention.
Yeah. Okay. I see the importance of that.
Now, medication for kids, that's a different story.
Yeah. Is that ever necessary?
The guidelines generally recommend avoiding medication for children under 10,
Okay.
unless they have severe dyslipidemia or multiple risk factors.
Right.
But if lifestyle changes aren't enough, statins and other medications might be considered.
Under close medical supervision, of course.
Of course, always.
Always.
It's all about weighing those risks and benefits.
Right.
And now, what about the other end of the spectrum, older adults?
Yeah. How does dyslipidemia management change as we age?
Well, again, it comes down to personalized medicine.
Okay.
As we age, other health conditions and medications might come into play.
Right. More comorbidities.
Exactly.
Pharmacy.
Exactly, making dyslipidemia management more complex.
So, for instance, someone might be taking multiple medications for different conditions. And those medications could interact with statins or other lipid-lowering drugs.
Absolutely. It's like a delicate balancing act.
Right.
The guidelines really emphasize the importance of carefully considering an individual's overall health status,
Okay.
their risk factors, and their preferences.
Right, their goals.
Exactly,
Yeah.
when making treatment decisions for older adults.
It's not just about lowering cholesterol at all costs.
Yeah,
It's about finding the right approach for each individual,
absolutely.
taking into account their unique circumstances.
You've hit the nail on the head.
It's all about personalized medicine.
Yes, and these guidelines really drive that point home.
Yeah.
It's not a one-size-fits-all approach. It's about finding the right fit for each person.
Love it. And that brings us back to this idea of the adherence challenge,
Yeah,
which I think is so important.
absolutely.
We can have the best guidelines and the most effective medications in the world, but if people aren't taking their medication as prescribed or making those lifestyle changes, it's all for nothing, right?
Absolutely. Adherence is the cornerstone of effective dyslipidemia management.
Okay, good. I'm glad we're on the same page here.
And as we discussed earlier, the guidelines offer some great strategies for improving adherence,
Oh, yeah.
like patient education, technology-based solutions, and fostering better communication between doctors and patients.
Right. It's all about empowering patients to take control of their health.
Exactly.
And that empowerment starts with knowledge.
Yes.
Which is why I think these deep dives are so valuable.
I couldn't agree more.
We're giving people the information they need to have informed conversations with their doctors and make the best decisions for their health.
Knowledge is power.
Absolutely, especially when it comes to something as important as heart health.
Couldn't have said it better myself.
Okay, so we've covered a lot of ground here, from dietary recommendations to special cases to the importance of adherence.
We have.
But I want to circle back to this idea of ApoB for a moment.
Okay, yeah.
I'm still a little fuzzy on the details.
Sure.
Can you walk me through exactly what ApoB is
Mhm.
and why it's potentially such a game changer?
Of course. So, as we mentioned earlier, ApoB is a protein that's found in all the atherogenic lipoprotein particles.
Okay.
Those are the bad cholesterol particles that contribute to plaque buildup in your arteries.
Right.
Basically, every single one of these bad cholesterol particles has one ApoB molecule attached to it.
Okay, so by measuring ApoB, you're essentially counting the number of these bad cholesterol particles floating around in your blood.
Exactly. And that's why some experts believe ApoB could be a more accurate measure of cardiovascular risk than traditional cholesterol tests, which only measure the amount of cholesterol in your blood, not necessarily the number of particles carrying it.
So someone could have a seemingly normal LDL cholesterol level,
Right.
but if they have a high number of ApoB particles, they could still be at increased risk of heart disease.
Exactly.
Interesting.
It's like looking under the hood of a car. You might see a normal fuel gauge, but if the engine is sputtering, you know something's not right.
That's a great analogy. Okay, so are the guidelines recommending that everyone get their ApoB levels checked?
Not quite yet.
Okay.
It's still an emerging area of research, and there's some debate about whether ApoB should replace the standard lipid panel
Right.
or simply be added as an additional test.
I see.
But the guidelines do highlight the potential of ApoB as a valuable biomarker and suggest that it could be particularly useful in certain situations, like for people with familial hypercholesterolemia or for assessing cardiovascular risk in younger populations.
So it's definitely something to discuss with your doctor.
Absolutely.
And speaking of discussing things with your doctor, that brings us to another important topic, the importance of clear communication.
Right. Open and honest communication between doctors and patients is essential for effective dyslipidemia management.
For sure.
Patients need to feel comfortable asking questions, expressing concerns, and discussing potential side effects.
Yeah, and doctors need to be good listeners, right?
Absolutely.
They need to take the time to understand their patient's individual circumstances, preferences, and goals.
It's a partnership, not a dictatorship.
Right.
The doctor provides the expertise and guidance, but the patient is ultimately the one who makes the decisions about their health.
And those decisions are much easier to make when you have all the information, which is why we do these deep dives.
I couldn't agree more.
We're giving people the knowledge they need to be active participants in their own healthcare.
Knowledge is empowering. And when it comes to something as important as heart health, everyone deserves to be empowered.
Okay, so we've covered a lot of ground here, from the basics of dyslipidemia to the latest research on ApoB and the importance of communication.
A lot of ground.
But I want to shift gears for a moment and talk about something else that's really important, the role of lifestyle.
Okay, yeah.
We touched on this earlier,
Right.
but I think it's worth diving a little deeper.
Okay.
These guidelines emphasize that medication isn't the only answer, right?
That's right.
Lifestyle plays a huge role in managing dyslipidemia and preventing heart disease.
Absolutely. Lifestyle is a cornerstone of heart health.
Okay, good.
In fact, many of the risk factors for dyslipidemia and heart disease are directly related to lifestyle choices, such as diet, exercise, smoking, and stress management.
So let's break it down.
Okay.
What are some of the key lifestyle recommendations the guidelines highlight?
Well, when it comes to diet, the guidelines emphasize a heart-healthy eating pattern that's rich in fruits, vegetables, whole grains, and lean protein sources. They also recommend limiting saturated and trans fats, cholesterol, sodium, and added sugars.
So it's basically the same dietary advice we hear for overall health, right?
Yeah.
Eat more plants, less processed food, and watch your portions.
It's not rocket science.
But you'd be surprised how many people struggle with that.
It's true.
Okay, so what about exercise?
So the guidelines recommend at least 150 minutes of moderate intensity aerobic activity
Okay.
or 75 minutes of vigorous intensity aerobic activity per week spread throughout the week.
So that's about 30 minutes a day, 5 days a week.
Yep.
Of something like brisk walking, swimming, or cycling.
Exactly.
Okay, got it.
And they also recommend incorporating muscle strengthening activities at least twice a week.
Ooh, so it's not just about cardio.
No.
It's about strength training too.
Absolutely. This could include things like lifting weights, doing resistance band exercises, or even just body weight exercises like push-ups and squats.
Got it. So it's about building strength and maintaining muscle mass.
Exactly. And then, of course, there's smoking.
Oh, yeah, the big one.
I know it's a broken record at this point, but smoking is one of the worst things you can do for your heart health.
It damages your blood vessels, increases your risk of blood clots, raises your blood pressure and cholesterol levels. It's a recipe for disaster.
It really is. If you smoke, quitting is the single best thing you can do for your heart.
Great advice.
And lastly, there's stress management.
Stress management. Okay.
While stress itself isn't a direct cause of dyslipidemia, it can contribute to unhealthy behaviors like overeating,
Oh, yeah, stress eating.
smoking, lack of exercise.
For sure.
So finding healthy ways to manage stress,
Right.
like yoga, meditation, spending time in nature, or pursuing hobbies you enjoy, is important for overall heart health.
It's all about taking a holistic approach to heart health, addressing both the physical and the mental aspects.
You got it.
So it's not just about taking a pill, it's about making lifestyle choices that support your heart health.
Absolutely. Lifestyle is a powerful tool, and it's something we all have control over.
I love that.
By making healthy choices, we can significantly reduce our risk of dyslipidemia, heart disease, and other chronic conditions.
That's empowering.
And these guidelines provide a great framework for making those healthy choices.
Yeah, they really do.
They're packed with evidence-based recommendations and practical tips that anyone can follow.
Okay, so we've covered diet, exercise, smoking, stress management. Those are the biggies.
The big four.
But what about other lifestyle factors like sleep and alcohol consumption?
Oh, those definitely play a role in heart health as well.
Okay, good.
Sleep is essential for overall health, and studies have shown that chronic sleep deprivation can increase the risk of heart disease, stroke, and other health problems.
Right, sleep is so important.
It is. The guidelines recommend aiming for 7 to 8 hours of quality sleep per night.
Make sure you're prioritizing those zizzies.
Definitely.
And what about alcohol?
Well, the guidelines recommend moderate alcohol consumption, which means no more than 1 drink per day for women and no more than 2 drinks per day for men.
Okay.
And of course, if you don't drink, there's no need to start.
Right. It's not about encouraging alcohol consumption. It's about setting safe limits for those who choose to drink.
Exactly.
Okay, I like that.
And it's important to note that even moderate alcohol consumption can be harmful for some people, such as those with certain medical conditions or those taking certain medications.
Right.
So, talk to your doctor about what's right for you.
Great point. It's all about making informed choices and understanding how your lifestyle habits impact your heart health.
Couldn't have said it better myself.
Okay, so we've talked about lifestyle, we've talked about medication, we've talked about communication, and we've even touched on some cutting-edge research.
We have covered a lot.
But I think there's one more piece of the puzzle we need to address.
Okay.
The importance of ongoing monitoring.
Absolutely. Managing dyslipidemia isn't a one-time thing, it's a lifelong journey.
Right. It's not a quick fix.
No, regular monitoring is essential.
Yeah.
To track progress, adjust treatment as needed, and address any new or emerging risk factors.
Makes sense.
It's a process.
So how often should someone be getting their lipid levels checked?
Well, the guidelines recommend checking lipid levels at least once every 5 years for adults who are at low risk for heart disease.
Okay.
But for people who are at higher risk, such as those with diabetes, high blood pressure, or a family history of heart disease, more frequent monitoring is recommended.
Right, so it depends on your individual risk factors.
Absolutely. And those monitoring intervals might change over time.
Oh.
For example, someone who's just starting a new medication might need more frequent monitoring to ensure they're tolerating the medication and that it's having the desired effect.
Right, just to make sure everything's going okay.
Exactly. It's all about individualizing the monitoring plan based on the person's specific needs and risk factors.
Makes sense.
And it's not just about checking lipid levels, it's also about monitoring other factors that can impact heart health, such as blood pressure, blood sugar, weight, and smoking status.
Right, so it's a comprehensive approach to heart health.
Exactly. It's about taking a holistic view of the person and their overall health and well-being.
I like that.
So it's a journey, not a destination, right?
It is.
We're constantly learning and evolving, and our healthcare needs change over time.
Absolutely.
The key is to stay informed, stay engaged, and stay proactive about your heart health.
Great advice. And these guidelines provide a great foundation for doing just that.
I agree.
They empower us to take control of our health and make informed choices that support our hearts for years to come.
I couldn't agree more.
Okay, so we've covered a lot of ground here. From the basics of dyslipidemia to the nuances of personalized medicine, the importance of lifestyle, the role of communication, and the value of ongoing monitoring.
We have.
It's been a fascinating deep dive. What are some final thoughts you'd like to leave our listener with?
I think the main takeaway is that dyslipidemia is a serious condition, but it's not a death sentence.
Right.
With the right knowledge, the right tools, and the right support, we can effectively manage our risk and live long, healthy lives.
Absolutely.
These guidelines provide a wealth of information and guidance, empowering us to take charge of our heart health.
Well said. And if you haven't already, be sure to talk to your doctor about your lipid levels and get personalized advice on how to protect your heart.
Absolutely. Early detection and intervention are key.
Great advice.
Yeah.
And as always, thanks for joining us on this deep dive into the fascinating world of dyslipidemia management in India.
You're welcome.
We hope you found it informative and empowering.
And remember, this is just a snapshot in time.
Right, exactly. What's so exciting about these guidelines is they really do represent the latest and greatest, but this field is always evolving.
Always. What's cutting edge today might be standard practice tomorrow.
Exactly.
That's the beauty of science. It's a never-ending story.
Always learning more.
Speaking of exciting new chapters, did you see this section on managing dyslipidemia in people with conditions like HIV?
Oh, yeah?
COVID-19, even organ transplant recipients.
Yeah, it really highlights how interconnected our health is.
It is.
It's like dyslipidemia management becomes this multi-dimensional puzzle when you factor in all these other pieces.
Exactly. And these guidelines don't shy away from that complexity.
No, they don't.
They acknowledge that there's no one-size-fits-all approach.
Right, right.
For example, I was reading about how inflammatory conditions like rheumatoid arthritis can actually mess with lipid levels.
Oh, interesting.
Yeah, and the guidelines provide specific recommendations for those cases.
Okay.
Often a combo of meds, lifestyle tweaks, and really close monitoring of how active the disease is.
It's amazing how everything is connected.
It is.
You start tugging on one thread, and it impacts the whole system.
The whole system.
Makes you appreciate the holistic approach these guidelines advocate for.
Couldn't agree more, and I think that's what makes these deep dives so valuable for your listeners.
Yeah.
We're not just spitting out facts.
Right.
We're connecting the dots, helping people become informed advocates for their own health.
It's like we're giving them a backstage pass to the world of cardiology.
Exactly.
Minus the awkward green room snacks, of course.
Of course.
But seriously, having this kind of knowledge is power.
Absolutely.
Especially when it comes to those crucial conversations with doctors.
You nailed it. And speaking of those conversations, remember our chat about medication adherence?
Yeah.
Those challenges can often be overcome if there's that open, honest dialogue between patient and doctor.
Oh, absolutely. If someone's having side effects or maybe they can't afford the meds, they need to feel comfortable bringing that up.
Absolutely. No shame.
No shame at all.
It has to be a partnership built on trust and clear communication.
Right.
And I love how these guidelines emphasize that collaborative approach.
Yeah, it's a shift from the old school doctor knows best mentality to something way more empowering for patients.
That's about time, right?
Totally agree. Okay, before we wrap up, I got to ask crystal ball time. What's the future of dyslipidemia management look like? Any breakthroughs on the horizon that'll have us all geeking out?
Well, we can't predict the future, but based on what we're seeing now,
Yeah.
buckle up. Research on ApoB is moving fast,
Okay.
and it could seriously change how we assess and manage risk.
Imagine one test that gives us a clearer picture of heart health than all those traditional lipid panels.
Oh no, right?
It's pretty mind-blowing.
It is, and beyond ApoB, there are some seriously cool new medications in the pipeline.
Oh, like what?
Think even more powerful PCSK9 inhibitors, even gene therapies that could potentially cure familial hypercholesterolemia.
Gene therapy for high cholesterol. That sounds like straight out of Star Trek.
It's an incredible time to be in this field.
It really is.
There's so much innovation happening. It gives me hope.
Hope and maybe a little bit of job security for you, right?
Maybe. Just kidding.
But seriously, it's inspiring to see researchers pushing the boundaries like this.
It is, and these guidelines capture that spirit perfectly.
Yeah.
They're not just playing catch-up, they're paving the way for what's next.
Well said. I think that's a perfect note to end on.
I agree.
This has been an awesome deep dive. To our listener, thanks for nerding out with us on this fascinating world of dyslipidemia management in India.
It's been a pleasure.
Keep learning, talk to your doc, and most importantly, be your own heart health hero.
Until next time, stay curious and stay healthy.